Hello everyone, welcome back to my channel. I am Shubha here. I hope you like this video. Please do like, share, comment and don't forget to subscribe. Today in this video we'll discuss about MF scale, Morse fall scale for fall risk assessment. What is MF scale fall risk assessment? MF scale is a fall risk assessment tool that predicts the likelihood that a patient will fall. It should be done at least once a day and with change in patient status, and it provides the information needed to tailor interventions to prevent falls. What are the areas of fall risk? The areas of fall risk identified are history of falling, secondary diagnosis, ambulatory aid, IV therapy or heparin lock, gait and mental status. In the screen you can see a sheet which consists a checklist for fall risk and the interventions which can be adopted to prevent fall. This sheet is for calculation of score according to the parameters. According to Morse fall score, if the score is 45 or higher, it is considered as high risk. If the score is 25 to 44, moderate risk, and if the score is 0 to 24, it is of low risk. History of falling. Score will be 0 if none of the following are true. Patient has fallen during this hospitalization. Patient has immediate history of falls within the past 3 months. Score 0 if the patient has no history of falls. Score 25 if one or more of the above are true. Secondary diagnosis. Score 0 if only one active medical diagnosis, and score 15 if more than one medical diagnosis is active for current admission. Ambulatory aid. Score will be 0 if the patient walks without a walking aid or uses a wheelchair or is on bed rest and does not get up at all. Score 15 if patient uses crutches or a walker. Score 30 if the patient walks clutching onto furniture for support. Example, needs help but does not ask or does not comply with order for bed rest. Intravenous or heparin lock. Score 0 if the patient does not have an IV or heparin lock or is not attached to equipment. Score 20 if the patient has an IV heparin lock or is attached to equipment, example monitoring equipment or Foley catheter. Score 0 if the patient has a normal gait, walks with head erect, arms swinging freely at the side, striding without hesitation. Score 10 if the patient has a weak gait, stooped but able to lift head without losing balance. If furniture required, uses as a guide. Feather weightage, short steps may shuffle. Score 20 if the patient has an impaired gait, difficulty rising from chair, needs to use arms several attempts to rise, head down, watches ground while walking, cannot walk without assist, grabs at furniture or whatever available, short, shuffling gait, wheelchair. Score according to gait used at transfer. Mental status. Score 0 if the patient's mental status is normal. Score 15 if the patient is considered to overestimate his or her abilities or is forgetful of limitations. To test mental status, ask the patient, are you able to go to bathroom alone or do you need assistance? Normal, patient response is consistent with orders. Overestimate or forgets limitation, patient's response is inconsistent with ambulation order or unrealistic. Calculate fall risk status. Assess each area of risk using MFS. Fall risk can range from 0 to 125, 0 no risk for fall, less than 25 low risk, 25 to 45 moderate risk, more than 45 is high risk. Interventions to prevent fall. Area of risk from MFS. History of falling. Interventions. Safety precautions. Communicate risk status via plan of care, change of shift report and signage. Document circumstances of previous fall. Secondary diagnosis. Consider factors which may increase risk for falls, illness, medication timing and side effects such as dizziness, frequent urination, unsteadiness. Ambulatory aid. Ambulatory aid at bedside if appropriate. Consider PT consult. And IV therapy or heparin lock. Implement toileting rounding schedule. Instruct patients to call for help with toileting. Review side effects of IV medications. Gait, assist without of bed. Consider PT consult and mental status. Bed alarm or chair alarm. Place patient in visible location. Encourage family presence. Frequent rounding. Thank you. I hope you like this video.